I just couldn't breathe at all. No wheezing or anything, just couldn't breathe. I personally thought I was gonna pass out or die or something.
An unusual strain of enterovirus called EVD68 has been hitting children hard.
White as a ghost, blue lips. He just passed out, had his eyes rolled back in his head, and had to call 911.
At least half a dozen states have confirmed cases, and more than a dozen have reached out to the Centers for Disease Control for help. An official at the CDC says these cases might just be the tip of the iceberg, and children's hospitals have seen an alarming number of children coming in with serious respiratory illnesses.
Right before the Labor Day weekend, we were seeing numbers in the 150 to 160 per day. These children became quite sick pretty quickly. Some of them within 12 to 24 hours. They were seeing symptoms, and we're seeking treatments. That their treatments weren't working at home.
Children with asthma have been hit the hardest.
If it's a cold, treat it like a cold. Don't panic. If your child does have asthma, give them the therapy that they've been prescribed.
This is enterovirus season, late summer and early fall, but why has this type, first identified in the 1960s, gotten so out of hand this year?
Why one virus or another crops up is inexplicable. It's a mystery to me.
Joining me to talk more about this is Dr. Marianne Jackson. She's Division Director of Infectious Diseases at Children's Mercy Hospital in Kansas City. Welcome to the program, Doctor.
Thank you so much.
You there in Missouri, you were really the first ones to observe and track the virus, and so you're arguably more familiar with it than just about anybody else. I think the thing that grabs everyone's attention, Doctor, is that it starts off looking like the common cold and then progresses rapidly. So how can parents, in this case, tell the difference?
So our experience started about mid-August, and what we found was large number of children being admitted to our hospital to the point our average daily census would be 240, 250 this time of year. We were upwards of 300. We tracked this back to an unusual virus circulating, and what we found was these children who were unusually sick mainly had asthma and weren't responding very well to their asthma treatments. So that was our tip-off, and that's where we started tracking this virus as it's gone through our community, and we're now nearly 6 weeks into it.
And what, I mean, how do parents know, though? I mean, and we know it progresses rapidly, but how do they know that it's something more serious than the common cold, and when should they be seeking help?
So it's interesting. I think there's two things that parents should know. Number one, enterovirus 68, when everything is said and done, probably is mainly going to be manifest as common cold symptoms. And not every common cold is due to EV68. Those children who are most severely affected, though, they got sick very quickly. So cough, runny nose, and within 12 to 24 hours, rapid breathing, and couldn't catch their breath. For children with asthma, they couldn't speak a full sentence. Most of these parents knew very, very quickly that their child needed help and they needed to get to the emergency room fast. So it really declares itself. And I tell parents that the powers of observation that they use typically in looking at their child when they have cold symptoms, and cold symptoms being very common in children, they will recognize this. It is not a secret virus. It declares itself very quickly, very rapidly, and this difficulty breathing is what sets the tone for parents to know they need to seek help, especially for children with asthma.
I think that's a really important point, and you use this term that it declares itself, and you sort of know, I think, is what you're saying. Parents will recognize that this is different. We have been tracking this as well, and late this week we got word that the virus has spread to the Northeast. You probably heard that, Doctor. Other parts of the country also starting to test positive, but you have said something I think is important, that in your region the numbers seem to be coming down. What are we to read into that? Is this coming under some sort of control?
I think it absolutely is. But one thing that I think is very important, Dr. Gupta, is that, you know, this virus, August is our down season for viruses in terms of respiratory viruses, but we are getting into our season where we are in respiratory viral season. So in my area here, enterovirus 68 is going down. Common cold like rhinoviruses of a variety are coming here, and most viruses are very predictable. So enterovirus, which you know there are quite a number of viruses, typically fever, rash, not respiratory symptoms like this year. But as we go in, our September, October is marked by rhinovirus, We'll get into RSV season, which is very predictable in November, and then into influenza season. So I think we're going to go back to back to back in viruses this year and not have that lull, at least not in my community, that we would normally have before we get well into respiratory virus season. And that's important because parents need to be prepared, and it's a good opportunity to prepare for the respiratory viral season.
Yeah, no, it's a really good point. And again, getting back to that issue that parents really need to keep an eye on their kids during this viral season, if you will. Dr. Marianne Jackson, thanks so much for joining us.
You're welcome. Thank you very much for having me.
Yep. President Obama says he's going to visit the CDC headquarters in Atlanta this week. He's going to get a briefing there on Ebola. Now, one of the reasons this is happening is because the head of the World Health Organization says the number of new cases is still growing faster than our ability to control them.
The Ebola outbreak that is ravaging parts of West Africa is the largest, most severe, and most complex in nearly 4-decade history of this disease.
Let me give you a little bit of context here on what she's saying. I mean, right now there are more than 4,000 cases, and the WHO predicts that Ebola will sicken 20,000 people before it's brought under control. But there was this new analysis, and it was partly funded by the U.S. government, that says even those numbers could be optimistic. Here's what they say. At the current rate of infection, we could hit 20,000 by mid-October. Now, if public health efforts start to help, the number of cases would only double to around 8,000 or so in the next month. But if conditions worsen, then they say the case count could top 50,000. Look, we've been in West Africa covering this story. We've been covering the story right here in the United States. We're going to keep covering the story, keep you informed, and tell you what you need to do to stay safe.